How does mechanical thrombectomy treat large vessel occlusion stroke? Imagine a major highway suddenly blocked by a huge traffic jam. Now picture that happening inside your brain's blood vessels during a stroke. When a large artery becomes blocked by a blood clot, it's called a large vessel occlusion. These arteries include the internal carotid artery, middle cerebral artery, anterior cerebral artery, posterior cerebral artery, and basilar artery. Because these arteries supply large parts of the brain, a blockage can cause rapid and severe damage. Without quick treatment, it can lead to serious disability or even death. Standard treatments like clot-busting drugs, called thrombolytics, sometimes aren't enough when the clot is large or in a major artery. That's where mechanical thrombectomy comes into play. It's a procedure designed to physically remove the clot and restore blood flow. The process begins in a specialized stroke center with a team of trained doctors. The patient is usually sedated or under anesthesia. Using imaging like CORT or MRI scans, the team guides a thin tube called a catheter through an artery in the groin up to the site of the blockage in the brain. Once the catheter reaches the clot, a device such as a stent retriever or an aspiration catheter is used. A stent retriever is a tiny mesh tube that expands inside the clot, grabbing it securely. The device then pulls the clot out, restoring blood flow through the artery. Alternatively, aspiration catheters use suction to remove the clot directly. The goal is to reopen the blocked artery as quickly as possible to minimize damage to the brain tissue. Not everyone with a stroke is a candidate for this procedure. It works best when the stroke is caused by a large vessel occlusion, and the patient is within a certain time window from when symptoms started, usually up to 6 to 24 hours. Doctors also look for signs that enough brain tissue can still be saved. Recognizing symptoms like sudden weakness, speech difficulties, or neglect helps identify potential candidates early. Rapid assessment and transfer to a stroke-capable hospital are crucial because every minute counts. The benefits of mechanical thrombectomy are significant. Many patients experience a reduction in disability and a better chance of returning to independent life. However, like all medical procedures, it carries some risks. These include bleeding, damage to blood vessels, or, rarely, causing a stroke elsewhere in the brain. The decision to perform the procedure depends on weighing these risks against the potential benefits for each individual. In emergency care, time is of the essence. The phrase "time is brain" highlights that the faster treatment begins, the better the outcome. Emergency medical teams use quick assessment tools and imaging to identify large vessel occlusions and get patients to specialized centers without delay. Coordinated efforts among emergency services, neurologists, and neurointerventionalists help ensure patients receive timely care. Overall, mechanical thrombectomy has transformed stroke treatment for large vessel occlusions. It offers a powerful option to save brain tissue and improve recovery chances. It is now part of standard care supported by health authorities worldwide. But it's important to remember that prevention, early recognition, and comprehensive post-stroke care are equally vital. Always consult healthcare professionals for personalized advice. This information reflects current medical understanding and aims to help you better understand how this life-saving procedure works.